name is Mary Francis, student number 100-723-987. I'm a first year nursing student, and this is my ID. So today I'm going to perform catheterization. Before I perform catheterization, I have to make sure that I check the physician order and the policy agency. And then I'm going to introduce myself to the client, I'm going to provide privacy, I'm going to explain the procedure to my client, and then I'm going also to obtain consent from the client. After I get consent to my client, I can go ahead and do my pericare. Before doing the pericare, I have to make sure that the bed, at least the bed that is at a good height where I can perform the catheterization. And then I have to make sure that side rail of the other side, of the opposite side, it's up. And then after that, I have to make sure that my client has a waterproof pad on her bed. And then now I can go ahead and perform pericare. So before performing pericare, I have to wash my hands. After washing my hands, I'm going to put on disposable gloves. So when I put on disposable gloves, I can go ahead and perform pericare to my client. Then after that, I'm going to dispose gloves, and then I'm going to hand hygiene again before I try the equipments I have. So for catheterization, I have a catheterization tray with me here. I have a catheter, and I have my sterile gloves. So before I open the tray, I have to make sure that I attach the drainage bag onto the bed, and I have to make sure that the cap is closed. So after that, after I've attached the drainage bag, I can go ahead and open the tray. But before touching, before touching these equipment, I have to make sure that I sanitize my hands. So now I'm going to open my tray. And before opening my tray, I have to make sure that my client is in a good position before the procedure. So now I can go ahead and open the tray. So I'm going to use this bag as my disposable. I'm going to use this bag as my garbage bag. So I'm going to open it wider. Okay, and then now I'm going to open my tray. I have to make sure that the table setup is at waist on the waist height, and I have to make sure that the table is facing away from the patient. So now I'm going to open my tray. Okay. And now I have the faucet, transfer faucet again. Just have to hold it upright to avoid any contamination. And then I have to make sure that the tray I put in a square position. I can touch the steel border to position the tray. So now what I can do, I'm going to take the equipment that I have in the tray and put in the sterile fluid. Okay, so I'm going to open my catheter. So what I'm going to do, I'm going to put the forceps, the transfer forceps, 1 inch above the sterile border. to avoid any contamination. So I'm going to open my catheter. I have to make sure that it's above my waist. I have to make sure that it's not below my waist. And now I can use my forceps and then pull it gentle and away from me to avoid any contamination. And then I'll add it on my tray. And I'm going to put it here. And then what I'm going to do now, I'm going to perform I'm going to put on my sterile gloves. So before putting on my sterile gloves, I have to sanitize my hands. Okay. So now I'm going to put on my sterile gloves. And I have to make sure that when I'm opening after, it's also away from me to avoid any contamination. So with sterile gloves, I'm going to start with my dominant hand. And I have to make sure that I touch the still border of the gloves. Now I'm going to use my dominant hand and I'm going to put it underneath the cuff. Okay, now I can use this hand to fix the other glove. Now my hands are sterile. That means that I can touch only sterile equipment. So now what I'm going to do, I'm going to open my catheter. And so I'm going to open my catheter. And I have to make sure that when I'm opening my catheter, I'm coiling it to avoid any air exposure. And then I'm going to add it in the tray. Okay, I'm going to dispose that. And then I'm going to lubricate my catheter. Since I'm going to insert to a female catheter, I have to lubricate the catheter 2.5 to 5 inches. To 5 centimeters. So the catheter has to be lubricated 2.5 to 5 centimeters. And I have to make sure that I'm not getting contaminated, or I'm not contaminating any sterile equipment. So now I've lubricated the catheter. I'm going to attach it with the syringe. So with the syringe is going to help me to inflate the balloon. So in an event where my physician has told me to correct this urine specimen, I'm going to use this cap. But in this situation, I'm not going to use it, so I might still keep it in the tray. So I'm going to use the betadine, a solution to soak into the cotton. So I'm going to use this cotton to cleanse the urethra before inserting the catheter. So what I'm going to do now, I'm going to use the press drape and press it on the bottom. So I have to make sure that when I'm unfolding it, I do it very slowly to avoid any contamination. And when I'm pressing it down, I have to make sure that my gloves they're not contaminated. They have to still remain sterile. Okay. And then I'm going to use the fascinated drip, and I'm going to put it on top. Again, I have to make sure that the shiny part goes on the bottom. I have to make sure that I have a good review where I'm going to insert the catheter. So what I'm going to do now next, I'm going to take my tray, and the way I'm going to hold my tray, I'm going to hold it like this. And then now I'm going to cleanse the labia. So I'm going to make sure that cleanse the labia. So I'm going to do it 3 ways. So I'm going to start distal, proximal, and then in the middle. So I'm going to use my non-dominant hand to hold the area, and I have to make sure that, and once my hands has touched this area, that means it's contaminated. That means I cannot touch any sterile equipment. So middle, I'm gonna dispose it. Okay, and last one in the middle, and then I have to let it go. Okay, so now I'm going to insert the catheter. I have to make sure that when I'm putting the catheter, I touch it 3 or 4 inches from the tip. So this hand is contaminated. That means I have to still keep it here. So when I see the urine is flowing, I have to make sure that I advance my catheter 2.5 centimeter. So now I can go ahead and inflate the balloon. Okay, so now just have to dispose this, and then now I can take the drainage tubing and connect it to the catheter. So after I've connected the tubing, the drainage tubing to the catheter, that means I have to clean this place. So with the fascinated drip, I just have to tear it, and then after that I'm going to clean everything, and then after cleaning everything, I'm going to document what I've done. So I have to make sure that when I'm documenting, I include the size of the catheter, the type. I have also to include the volume of the solution that I used to inflate the balloon, and I have to make sure that I lower the bed of the client.